first, remember, Jamati, please mute your mic. Everybody, please mute your mic. All right, thank you. So, once again, actually, I'm excited because our method, the new reading part A method, is really practical and this is really workable. And we have to complete, 10 reading, samples with this method. So if here is somebody who doesn't know what is this method, I just have to recap that. Remember, to complete your part A in less than maybe 18 minutes. Please, Amrin, please mute your mic. Thank you. So what you have to do is please follow these steps. These are very easy steps and you can easily do that. Usually, FCES means facts, causes, effects, solutions. Usually, solutions are treatment. Any kind of treatment comes in the solutions area. Facts are numbers, okay, where a particular disease condition happens, how many boys die, how many men, how many women, which country, all those data. This one is like explanation, examples, and expansion. These are the three things that happens in the facts. Or we can, in a different way, we can say WH things. What, which, when. For example, you're talking about malaria. What is malaria? What causes malaria? Who causes malaria? Where does it happen? When does it happen? And how many people die? All those things are the data things. Facts are basically data. Okay. Usually, the text A is basically the facts text. Second one is causes. Most of the time, you will see causes here. How a particular thing happens. The causes of this one, bacteria, virus, whatever it is. Causes are there in the second paragraph. You can always check it. It is always true. Effects are like symptoms. Symptoms come in the category of effects. Okay, or you can say consequences. Consequences. Malaria, take malaria. What happens to a patient who has got malaria? So look at this one. This is known as FCES. That is easy. Now, the problem is, although majority of the text will be following the FCES mode, some of them will not be following that. So to show you that, please open the Melons 12 booklet and please locate reading 12.4 page number
36, sir.
36. Please open 36, page number 36. Okay, I hope you have opened that. Those who do not have this booklet, please get this booklet printed for the classes, because without this booklet, you cannot have this. So if you have not got the booklet, please, you can download from our group, or you can simply directly ask me, it will be sent to you. Just send your email ID. So anyway, this is the second last day of Melons 12. So Melons 1 will be restarted from the coming Monday. So you will be getting that PDF on this Saturday. So please take the printout. Without the printout, our classes are never going to be practical. Now, look at this one. Those who are having this booklet, take the stroke 1, page number 36. And you can see the first one. Can somebody tell me what is this all about? Is it facts, causes, effects, or solutions? I can show you, maybe more clearly, I can show you. Have a look at this one. Look at this, please. A cerebrovascular accident, or CVA, is commonly called a stroke. It is a fact. It happens when the blood supply to the brain is interrupted. Cause of this one. Can you see cause here? It is cause. Blood contains oxygen and important nutrients for your brain cells through a network of arteries. This is fact. Blood flow may be interrupted or stop moving through an artery because cause. Because is always cause. The artery is blocked. Ischemic stroke. or burst. These are all causes of this one. When brain cells do not get enough oxygen or nutrients, they die. That is also a cause of something. Causes. So you can see that text A is full of causes and facts. Okay, causes and facts. Okay, and can you also find some solutions here? Maybe stroke is a largely preventable event and many risks can be reduced by making lifestyle changes. This is the solution. So here a bit of solution is also here. There are other reasons. Yeah, again we are going back to reasons. Reasons means causes. That means this first paragraph is entirely, or the majority of this first paragraph is about causes or reasons. So usually I told you, facts will be the primary part here. But remember, a cause is a fact, effect is a fact, solution is a fact, effect is a fact. So fact is common everywhere. I hope it is clear to you. Now, you have to stay here till the end of this class. Otherwise, you won't understand the what do you say what do you say the real meaning of this. Okay. Now listen. Now coming to the last one, lifestyle factors likely to increase stroke risk are being overweight or obese. Causes, again causes. So did you notice that everything is cause in this area? So we are getting it more clear, and I am taking you to the other paragraphs as well. Please come to the other paragraphs. I will show you how this works really. So we have seen the first one, and it is majority of this is the causes of stroke. Let's go to the second one and what is there. Okay, come to the second one. Please open the text number B. There you can see it is all about, you can also see one graph also is there. There is a graph. There is a graph also there. Incidence of stroke in Australia. So this is completely, the second one is completely, text B is facts. This is basically, this is the facts. Usually facts include in numbers. How many people die, the percentage of something, and all the things. You can also see a chart, a graph is there. You can see a graph. That is also information. So very clearly, text B is facts. That is very clear to all of you. I'm taking you to the third one, text number C. Can somebody tell me what is there in the text number C? Can, just by reading this one, can you tell me what is the main content? Is it a FCES? Which one? Can somebody tell me?
Treatment and solutions.
Treatment is basically solution. Okay, what else do you see? What else?
Effects.
Yeah,
Effects.
yeah, from here onwards, almost from here onwards, you can see the whole thing is effects. I mean, effects, that means the symptoms. Basically, the symptom paragraph it is. So you can also come to this area. Everybody, you can read that. You can read and understand that. You can read and understand. When the person gets to hospital, they need to have the type of stroke they have experienced diagnosed quickly. Tests that are commonly used include. So here, from here onwards, these are the test area. So text number C is, you can see effects are also there, and then it also has solutions also here. Solutions. Just in this area, solutions or treatment. Solutions and treatments are almost the same thing. Coming to D, please come to the D part. You can see here, the whole thing is what? Can somebody tell me? Rehabilitation. What is the meaning of rehabilitation? Why do we do rehabilitation? Rehabilitation is part of treatment, and treatment is solution.
Solution.
So very clearly, what you have to do is, when you do this part A, you have to take your pencil and you have to start marking there. What are you going to start marking? You are going to mark like the first one is here. You can see courses are here, okay, and then a bit of solution is here, a very small area. Then we have also got Like there are other reasons. Okay, courses are here, more courses are here. Like, okay, this is also course of this one. So what you have to do is simply write CSCC this way. All right. Against each paragraph or each section, you just have to write. Then come down to the next area. In the second area, you can see facts are here. Basically, it is completely facts. Completely facts. Just mark F, F, F everywhere. Just or simply one F is enough. After this, you have to go to the third paragraph. This is what you have to do. Actually, this is really beneficial for all of you. When you come to this one, in this area, what you have to mark is, what are we going to mark here? C is all about what? C is,
Effects or solution.
yeah, solutions is coming here a bit. And then what is more than solutions? These are the
Effect.
effects. Yeah, effects are here, E. And then when a person gets to hospital, they need to have, okay, then again, solutions. So treatment means solution, okay, and symptoms are effects. So first of all of you have to understand the difference between FCES. All right. So then come to the last one, rehabilitation following. This is completely solution, solution, solution. You can just write only once, that's enough. So after write, okay, can I ask you, Alfonso, if I am asking you, how much time do you want to mark these things by reading the whole thing? How much time you may require? I can tell you, just 2 to 3 minutes will be enough. 2 to 3 minutes. And you can also make it like 2 minutes if you really practice. Just 2 minutes will be enough. So earlier, see, earlier or even now, what you are doing is you are just trying to understand the complete text here. But we don't have time. We don't have time for understanding the whole text. So what are we going to do? We are simply going to do, if it is it facts, FCES, we are just going to mark. Now, if you have marked that, I'm going to take you to the next level. Now see, what is the benefit of marking? You can see here, the questions are here. The reasons people have a stroke. What do you mean by reasons? What do you mean by reasons? What is the other word for reason? Causes?
Causes.
Can you find causes any other area? Nowhere. Causes is only in text A, so you don't have to waste your time. You can simply go to the causes area. Second one, the types of rehabilitation. Rehabilitation, very clear. Rehabilitation solutions. At the same time, if there is another solution here also, but this is less likely, but this one, D is more likely. You don't have to waste your whole time. The signs and symptoms of a stroke. Signs and symptoms. You know what is that? Effects. You will not have to waste your time in any other area. And going to the fourth one, the death rate from rate, very clear. Rates are what? Facts. Yeah. Anybody feels like this is a good idea?
Yes, sir. Very good idea.
Finally, we got this. For the last 2 years, I was after this one. And finally, I got it. And you too got it. Okay. And that's fifth one, the most common type of stroke. Of course, the most common type. This is, of course, you should understand this is a fact. This is a fact thing. Going to the sixth one, the role of speech and language therapy. Therapy is, of course, it is a solution. But of course, we have one more solution here. Okay, but you will find the answer in text D rather than in text A, because text A solutions are very, very rare. Going to the seventh one, the lifestyle of factors that are likely to increase the risk of stroke. Increase the risk of stroke. Causes? Do you agree with me? Causes?
Yes, sir.
Yes,
Yeah,
sir.
understanding these things is really going to help you. If you think this is just a magic or something, I can show you the remaining part of this magic. How many people in Australia? How many people? Numbers, 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 facts. See, in this area you can find that. So you don't have to waste your time. In less than 18, sorry, in less than 15, maybe 13 minutes, you will be able to complete these 20 questions. I'm 100% sure about that. What part of a stroke rehabilitation program focuses on rehabilitation program, that is solution area rehabilitation. Okay, solution is also found in this area, but less likely. Going to the 10th one, what type of stroke occurs when an artery in the brain bursts? A cause of this one. There is a cause. Okay, artery in the brain bursting is a cause. So where is the cause? And here. But at the same time, in the fact area also, you may find the same answer, but more chances for text A, that is the causes area. 11th one, which word is useful to check if someone may be having a stroke? Which word is useful to check? Check means all about solutions. In the solution area, you will find that one. Maybe this is not very clear to some of you. See, you have to check means what? You have to assess. Assess means diagnose. Okay, so basically that will be the best area to find. Then what's the brain's ability to change and adapt called? What is the brain's ability to change and adapt called? In most of the cases, this will be found in the facts area. What kind of hospital units are showing significant improvement in the outcomes of stroke patients? Improvement happens only when you give this treatment or rehabilitation solution. So this will be the most accurate area. Sometimes it can be also in the effects area, but less likely. It can also be found in the numbers and facts area, less likely. Then coming to the 14th one, how might a person's speech sound if they are having a stroke? Can somebody tell me in which area you will find that? How might a person's speech sound? A speech change. Can somebody tell me?
Effects.
Yes, exactly.
B.
Yeah.
Effect.
Yeah, so the whole thing, if OET people come to know that we have a method like this one, they will, they will introduce a new method for reading. They will completely change this one. So this is a magic. Please, everybody understand that one. Your brain may be having other ideas also in your brain. sorry, and you are not able to decide which is the correct one. But I can tell you this is the best one. All right. Okay, how might a person's speech sound? So a speech sound means how the speech or the voice will change if they are having a stroke. That is in the effects area. If you want to know more about this one, I can show you more. Please give me some time. I'm going to show you the remaining 15 to 20 questions. All right. Now listen. Look at this one. Now, if a person is having stroke, you may notice their face has dash on one side. In which area can you find?
Effects.
Effect.
Yes,
Effect.
completely correct. Completely correct. But remember, sometimes it can be here in this also. But mostly in text C, effect area. Dash from stroke in Australia is getting less.
Facts.
Yes,
Fact.
absolutely. Okay, then 17, the most dash occurs in the first 3 months after a stroke.
Facts.
Most probably that will be also facts
Fact.
because these are numbers. And then going to the 18th one, I believe that everybody is following me. Maybe there are some of you who do not really follow me. So this video will be uploaded in the group. You can watch this and understand that. And if you didn't understand, please call me anytime. All right. So we have to go to the next one. That is 18. The stroke happens when the dash to the brain is interrupted. Can somebody tell me?
Versus.
Correct. All right. Then 19. The average length of stay in rehabilitation
D.
care. Rehabilitation D. It must be in this area. And the clot has to be dissolved by giving the patient a dash through an intravenous strip.
Solution.
Mostly solution. Yeah.
Solution.
Thank you that you really understood this one. Very good. So this is known as our FCES marking. So this is what you have to do first. So everybody will be able to complete your reading in less than 15 minutes, maybe even 13 minutes. And I'm waiting for somebody's reply. I mean, feedback about our method, how this is going to help them, how this is going to change their score. So how are you going to do? First, the steps now. I'm just concluding this one because we have to go to the mention practice right now. I feel that I have solved the reading part A problem for all the OET students. So if you feel that way, I have a small request to you. You have to share this video with all your friends who are practicing OET, not only for helping them, also for helping me to become a bit more popular, please. It won't harm anybody. Please do that way. So what are the methods here? First one, you have to mark. What are you going to mark? You are going to mark FCES. Okay. Second one, you have to start answering them. That is, from where are you going to start?
14.
Yeah, 8 to
8 to 14.
8 to 14 you will be doing. That is very important. Don't start from 1 to 7 in this point. After this one, you are going to do the last 6. Which are the last 6? That is 15
First
to,
to
15
15
to
to
20.
20.
Into 20, you will be completing that. Then you will be going to 1 to 7.
7.
This is the time for 1 to 7. That is done. After completing this, you have to check your numbering. I mean, whether you have done the numbers correctly. If there is any mistake in that, you will be losing that. And please make sure that your spellings are also completely correct. So this is the best way for part A. So what is this? Marks for M and E for 8 to 14. Last this one and O and then numbers and spelling. This is the Melons method for part A reading. I hope it is very clear to you. Please watch the video if you require to understand it better. And this is really a good idea. So please stop any other method that you are applying for part A. This will really help you if you are stuck in between two methods. Like you trust me, you trust somebody else, you trust a third person, you trust a fourth person. Everybody is equally good. And you'll be simply wasting your time. Either you follow me or you follow the other persons. Please never follow two trainers at the same time. Did you understand this? This is a very dangerous thing.
Yes.
People are spending a lot of time just because they are having more than one trainer. If you think that I am not as convincing than the other one, please leave me. Come on, no problem. Okay, that's very important. We are moving to the next one, that is mention practice, which is going to shake your head just now. This is?
Sir, 1 minute. Sir,
Yeah.
sir, can I ask something?
You can always ask.
Sir, in which part this topic stop, which is a number? Could you please tell me the number in the booklet? Sure.
Okay, you're talking about the particular
Topic.
stroke.
Yes,
36,
stroke.
page number 36.
Page number 36 in 12th, right?
Yeah, in third one.
Melon 12.
Yeah.
Okay. Thank you.
Okay, fine. You can find that. You can try any reading part A. You can try using this method, but this will take a bit of time. So we have started this 10 FCES Melons reading method. So this is the second one we have completed. We'll be having 8 more every day. But you should be having the booklet printed. So the next will be tomorrow we are having mock test. So tomorrow we may not be having a part A, but from Monday we'll be having that. The booklet will reach you by Saturday. So please get it printed by Saturday itself.